Autistic spectrum disorder is a neurodevelopmental disorder. That is, it's a disorder of the development and functioning of the brain. The onset occurs in early childhood, though it may come to light only later on in adulthood. It affects 1 in 100 children. They all share characteristics to varying degrees. These two characteristics are persistent deficits in reciprocal social interactions and communications across various contexts. Let's just call that difficulties with social interaction and communication. People with ASD find it difficult to understand the social world, including social rules and expectations. They also find it difficult to develop, maintain and understand relationships, and may have an abnormal social approach, have difficulty reading social cues and knowing when to speak and when to listen, and talk at length about their own interests. They find it hard reading facial expressions and have difficulty recognising and understanding their feelings and those of others. Some people with ASD may not be interested in their peers and prefer to spend time alone. The second characteristic is restricted, repetitive, stereotyped repertoire of interests and activities. Let's call that difficulties with behaviour, interests and activities. People with ASD have a narrow range of interests that are unusual in intensity or focus, such as having lists of dates, routes or timetables. Children may use toys like objects to line up. People with ASD find change very difficult and stick to fixed rules or rituals, insisting that things stay the same. People with ASD may have unusual responses to sensory aspects of the environment. For instance, they may have apparent indifference to pain or temperature and adverse responses to specific sounds, smells, tastes or textures. Some people show unusual repetitive rhythmic movements or postures that are predictable in patterns, such as hand or finger flapping or twirling, toe walking. These are known as stereotypies.